I'd like to address a very common topic that women bring to our attention. Several of our patients have stopped having kids and are talking more about long-term contraception. There are several options out there. Many women who are completely confident that they're done can look into things like sterilization. Male sterilization is a 30-minute office procedure called vasectomy that works with local anesthetic. Urologists do this often in the office with local anesthetic. Sometimes they'll take you to a surgery center for a little bit of sedation. There's no impact on sexual function. There's no impact on the male ejaculate, and it's durable and quite effective, relatively inexpensive, and a wonderful contribution for the male partner. Women could also explore sterilization. In the past, we've frowned on it since it often warranted laparoscopic surgery, which requires general anesthesia and is a longer recovery. But later data has shown that instead of dividing the fallopian tubes but removing them can give a woman a reduced risk of developing ovarian cancer in her life, since it was discovered that the fallopian tubes may be a source of seeding the ovary with ovarian cancer. So salpingectomy, or removing the fallopian tubes, might be not only permanent sterilization, but also a health benefit for women. For people that don't want to explore the sterilization option, lots of long-term options are available, such as the intrauterine device. There are two different types of intrauterine devices. The one that's been around a bit longer is the copper IUD, which is marketed under the name Paragard. It's an office insertion that takes between 5 and 10 minutes. The copper IUD, or the Paragard, stays in place or can stay in place for up to 10 years. The only real known side effect is that the menses may be a day or two longer or a pad or two heavier. So in the absence of exceedingly heavy or long duration menses, it's a wonderful single placement contraceptive that can last for up to 10 years. For women who opt out of contraception and want the IUD removed, it's once again a very simple office procedure to remove it, and your fertility returns to normal upon removal. For people that are plagued by heavy menses, the progesterone IUDs, and there are 3 or 4 different types that are on the market, aren't as durable. They last either 4 or 5 or 6 years, are also placed in the office. These may often be complicated by irregular bleeding, staining, or spotting for from 3 to 6 months. But the benefit is that after 3 or 6 months, that the periods become lighter, and a portion of women will skip their periods altogether. Similar to the Paragard, the progestin IUD can be removed at any point during its 4, 5, or 6 year life, and fertility returns to normal the next cycle. For people that aren't interested in sterilization or IUDs, birth control pills or hormonal contraception is yet another option. Birth control pills, or taking a combination of estrogen and progesterone on a daily basis, are safe and effective in a significant majority of women. There are certain risk factors that would preempt the use of birth control pills, but with birth control pills, there's a lifetime reduction in the risk of endometrial cancer. There's a lifetime reduction in the risk of ovarian cancer. It minimizes the bleeding, and so it's very helpful for women with heavy periods or people that have developed a low blood count as a result of their menses. It does require vigilance in that you need to take a pill every day. For people that aren't as diligent with taking a pill every day, there is a device called a Nuvaring. Nuvaring is a rubber device that's placed into the vagina. It stays there for 3 weeks and is removed and disposed of, and the period comes. So instead of taking a pill every day for 3 weeks and then getting a period for a week, a device, a rubber ring, is in the vagina for 3 weeks, and then it's taken out. And all you have to remember is that it's placed and the day it's removed on your reminder on your phone, or however it's easiest for you to remember that. Aside from birth control pills, IUDs, and sterilization, there are other long-acting progestin devices. There is a plastic insert that goes into the arm that can last for 3 years, that secretes progesterone, releases progesterone, and can be replaced every 3 years, one removed and one replaced. There are injections of depo-medroxyprogesterone acetate called Depo-Provera that's placed at 3-month intervals. And so there is a whole litany of long-term contraception. Short-term contraception for people that are more comfortable with that remain quite active in our repertoire, using condoms on a regular basis. Getting fitted for a diaphragm are still quite popular. Somewhat less effective and more reliant on the cycle is the natural family planning or using the calendar method. Most women will not conceive or have a very low probability of conceiving after ovulation. For people with regular predictable menses, the family planning method is yet another method. And using vaginal suppositories that are anti-sperm or spermicides can be added or combined with any of the above methods, like used with condoms, used with diaphragm, as well as used with natural family planning. We do frown upon withdrawal. It's felt that some ejaculate comes from the penis before the complete ejaculation, and so withdrawal prior to ejaculation is not the most effective method at preventing pregnancy. So that's the long and short of longer-term contraception, with a little bit included on shorter-term contraception. Please consult your gynecologist. We at Carnegie Women's Health are open for your questions, for your regular annual visits. Contraception is but one of the things that we do in this office.